Hello, everyone. Welcome back to another episode of the Smile Reconstruction Dental Implant Podcast. This is where we discuss everything dental implant related. And today we have a neat episode coming. This is where we get to talk about a specific type of case where we can get someone back to eating, back to smiling. And my name's Josh Muir. I'm here with Tanner Townsend. We are your hosts today. So Tanner, why don't you tell us what really is the process of making tooth replacement a reality for any patient? And to start with, why don't we start at the very, very beginning? What happens when a patient knows they need a tooth replaced and they're ready to start that process? What is step one?
Okay. Step one is recognizing that they have a problem with the current tooth or the space that they have that's empty. And so the first thing that needs to happen is that tooth needs to be removed if that tooth is still there. And if the tooth has already been vacant and it doesn't have a tooth there, we need to evaluate, is it able to receive an implant at that time?
So consult appointment, we figure out what the space is, what the bone is, what the health is, make a game plan.
Yep. So step one is to make a game plan. Step two at that point is to now execute the plan of placing the implant. So if we need to take out the tooth, we will take out the tooth first. And then in certain cases, we're able to place it right after we take out the tooth. And if the tooth has been gone a while, we will place the implant. So step two is to place the implant. And then step three is to wait. Hurry up and wait. We need to have the implant heal for 4 months.
Now, hold on now. So you're telling me so people can't get a tooth the same day? Are there cases where you can do a tooth the same day so they're not leaving without a tooth?
Great question. There are certain cases where we can do a tooth the same day. Oftentimes, it's a temporary tooth. It's not your final tooth. We can't have you chewing directly on that tooth because that can cause the implant to move. And if the implant moves, the implant's going to fail. So we don't have a final tooth. We have an adjusted tooth that we can do, especially on front teeth, where we can give you a tooth the same day, but it's not for all circumstances.
Okay. So step one, consult, create a plan. Step two, execute that plan, beginning with getting the implant in. If appropriate, such as a front tooth, we give them a temporary tooth or crown so that they can smile and speak and all of that stuff. Okay. And then you mentioned healing. So what is that healing period?
So healing is step three, and that's when we have to wait and let the implant fuse to the bone. And it takes 3 to 4 months, and typically we say 4 months just to be on the safe side, for new bone to grow around the threads of the implant. And it takes biologically that long to heal. And so we will let the implant heal for that space of time before we move to the next step.
Okay. Now, the patient goes through the healing period, they come back, and what takes place at that appointment? What's the next step?
The next step is to evaluate the healing of the implant and then prepare the implant to receive a tooth. And so at that appointment, we will do some records and scans for the implant to have a tooth put on it.
Okay. So at that appointment, is there numbing? Is there anything like that?
No numbing at all at that appointment. We can just go in and there's a little cap where we take the tooth part off if it's an area that we had a temporary tooth on, and we take an impression or a scan, and it's a quick appointment that involves no numbing at all.
Okay. So they come in for that. Essentially, we're getting the records and dimensions and colors and things that we need to make the crown. And then a couple weeks later, they come back, and what does that appointment look like?
Yep. Step 6 at that point is to get your tooth. And so we will attach the tooth to the implant, and at that point, we'll adjust the bite, make sure the color looks right, and at that point, we're done. That is,
and then they use it.
And then they use it. It's a 6-step process to getting an implant, and all the way from making the game plan to getting the implant in the bone, or getting your implant tooth that's back and looks like a natural tooth.
So that's the process. So Interesting. So if you were to talk to any patient in need of this service,
Hmm.
what is one line you could tell them just to help them understand, hey man, you got this. Like it's not actually that big. It's 6 steps, but what's a motivation? Like how do you motivate someone to take that action to move forward if they're a little hesitant?
Um, that's a good question. I think the thing that I try to help them realize is this is the closest thing to having your real tooth in there. We don't have to shave down teeth next door for a bridge. We don't have to um, compromise anything else in the mouth. This is going to be the closest thing to looking like a natural tooth, and it doesn't hurt that bad. One of the things that I have a lot of patients worry about is, oh, is it going to be super painful getting a screw put into my jaw? It's actually not as painful as getting a tooth taken out, that's for sure. And so I try to remind patients a lot of that, but those are the things that I typically let them know. Do you have anything else that you like to let your patients
You
know?
know, about the pain, that's a really good point. 2 patients I saw today, one of them said, you know what, I didn't even take a single Tylenol.
Mm.
That was his line. The other patient said, you know what, this was so wonderful. I can be your best advertisement telling people how easy it was.
Wow.
So, and that was just today. But yeah, don't let pain and discomfort be the reason.
Hmm.
Um, Dr. Townsend talked to us about that 6-step process from consult to walking out with your final tooth. And what you need to understand too is sometimes we combine some of those steps. You can come in for the consult, we start treatment right then, and then that healing starts. We do the final, and you're done. So
I thought it's essentially 3 steps at that point.
essentially 3 steps, yeah. So, and then if you find that you are someone that is in need of some of this treatment, or even if you just have questions about it, give us a call. Let's set up that free consult and let's see if we can help you out. Let's get you back to chewing, back to eating, back to smiling, and back to not worrying about that tooth that you know needs replaced. Well, that's it for today. Again, my name is Josh Muir here with Tanner Townsend, your hosts of the Smile Reconstruction Dental Implant Podcast. Thank you for joining us.